When you're going to talk about hormonal health, I think we have to back up a step and just remember what medicine's all about. We have to remember that our bodies aren't just a collection of organs that happen to, share the same space, but also that everything works together as a system. And so we have to treat everybody from that standpoint. And then our treatments as well can treat people from many different angles as well. So the testing is an important part of it, but you've got to start by looking at the whole picture and looking at all the organ systems. I think we've forgotten a little bit of that now in the way we go at medicine these days.
So when we say taking a step back and we talk about holistic medicine, what does that actually really mean to someone like you who's both a doctor as well as somebody that's really been pioneering in the field of holistic health?
Well, how's your skin? And if your skin's not good, what's behind that? Well, maybe there's something going on with your liver. And why is that joint aching? Well, maybe you're not eating the right foods. Maybe you should eat some cartilage. How's your hair? Well, maybe if your hair's not the best way it should be, maybe it's your thyroid gland. So looking at the person, taking a good history and a physical, like Sir William Osler said many years ago, ask your patient, and they'll tell you the diagnosis. So just gathering a lot of information about every aspect of the person or one particular complaint, and okay, let's give you a treatment for that specific symptom. You got to look at the constellation.
Now, would you agree that patients need to be aware of what's going on in their own body and therefore be able to contribute to giving information to their doctor or medical team?
I always used to ask my patients, well, what do you think's wrong? And sometimes they look at you like you have three heads, but then come to find out, well, they think they have cancer, or you have to solicit the patient's ideas about what's wrong. You have to empower patients to be able to say, yeah, I've got that wisdom. I know I feel it in my bones. This is what's wrong with me. Yes. So absolutely, you have to get people to tell you what they think, and you have to question them in a way that they can even get that information out of there, but